Thanks so much for taking my question today. I just wanted to ask about the wait to get a COVID test, particularly here in Northern Health and in Prince George. Hearing from parents of kids at schools that have tested positive, they've been phoning the line to try and get through to book a COVID appointment test, but couldn't get through or have been faced to wait days to get one. And they're going to walk-in clinics to get these tests and not a testing center itself. Is that acceptable? And if it isn't, what are you going to do to try and fix that?
We've recognized this has been an issue in the north as cases started to take off again a few weeks ago. It is something they're trying to address. It's not an easy question with all of these things. Once surge capacity is exceeded, it's hard to continue to build up the resources that are needed. But it is something we're looking at, how to make these more easily accessible in more places and to ramp up the capacity for testing. It's been a challenge in some other communities, but particularly, as you say, in Prince George and in some of the other smaller communities across the north where cases are surging. The bottom line is if you have symptoms, important to stay home. Yes, get those tests as soon as you can, and we will be working with Northern Health to make sure we're already in the process of trying to ramp up the testing again.
Caden, do you have a follow-up?
Just what is the message to local leaders here? Obviously, there's plenty of rural communities, especially that are unvaccinated, or, well, for the majority, unvaccinated below the rest of BC. Many of them are feeling a bit of defeat right now as, the holdups continue. Has the messaging changed? Is there anything more that they can do to get people vaccinated that are holding out right now?
I think that's a really good question. And we had really great meetings led by the minister last week with a number of leaders across the north. And this is a challenge. How do we put that positive information out there? This is not something to be defeated about. This is something that we have the agency. We know what we need to do to address. One of the important things is answering people's questions, making it available, making it convenient for people, and we're doing everything we can to do that. Addressing some of and I talked a little bit about this last week, the misinformation. So that's when things are a little bit of truth and then it gets twisted a little bit. Some of the things that I hear a lot are people wanting to have exemptions because they're immune compromised or because they have autoimmune conditions. These are all reasons to be immunized. And so having the people's questions answered in the right way, and we're trying to support physicians and immunizers and communities to be able to answer those questions for people. But also the positive experience of immunization and the fact that right now we're seeing this virus is affecting our community. And we all have the agency to work together to support each other. And as we talked about from the very beginning of this pandemic, we are all in this together. It's not about unvaccinated versus vaccinated. It's about all of us doing what we need to do to protect those we love and to protect our communities. Because what we're seeing in the north is that it is affecting my neighbor's ability to get care for whatever it is, their medical issue. And that means it's all of our business. The decisions that we make have consequences, and in some communities now, those consequences mean people can't get the care they need. It means that children can't safely go to school in some areas, perhaps. So these are the things that we need to think about as part of us getting together, working together to get through this. And Minister, you might want to add to that.
Well, I just want to express, first of all, my appreciation for mayors in the north. We have some communities. It's important to remember this if you look at communities across the north, that the vaccination rate first dose vaccination rate in Fort St. John is 69.4%, meaning the vast majority of people who are eligible to vaccinate have got their first dose immunization, and 69.4%, of course, is not high enough, but it's an indication that the vast majority of people understand and support immunization, and we need those numbers to. Equally, in a community like Vanderhoof, which I think has the highest per capita number of cases this past week, immunization rate is 68.3% in the community health service area in Vanderhoof, and in Vanderhoof rural area around Vanderhoof, that number is 59.7%. And Mayor Thiessen, I think, has shown exceptional leadership, as is Mayor Ackerman, as Mayor Bumstead in Dawson Creek, and all of our mayors, Mayor Hall, and all of the mayors in the region have shown great leadership, and we're very appreciative of that. And look, we have to keep going, right? Because there is one path forward, really, for communities, and that's the path of vaccination. And so we have to keep pushing forward. And remember, if your community is at 90%, you know what's better than 90%? 91% and 92%. If your community is at 68%, we have to continue to be put forward because it makes the community safer. And it's a way through this storm of COVID-19. So we are going to continue to work with mayors. I'm very appreciative of the leadership they're showing. We're making more efforts today in Northern Health to reach out to people on an individual basis and answer their questions. We're working across party lines, so you see the great leadership on vaccination shown by the Leader of the Opposition, Shirley Bond, by MLAs such as Nathan Cullen and Jen Rice and Dan Davies and Mike Bernier and Coralie Oakes and others. So we're all working together. We all see that every single time someone gets vaccinated, we all get safer. They get safer, their families get safer, we all get safer. And we just got to continue to push, and we're going to continue to do that and to support the North. I'll say this finally, that I think one of the challenges for communities is the potential and the division between people. And one of the reasons we stay positive, one of the reasons, and this is absolutely the case, that everyone gets provided care in BC. We made the decision to move some residents from Northern Health who are in critical care to Vancouver Island and Fraser Health and Vancouver Coastal Health. That is how it should be, that we support one another in difficult times, just as the North supports people in Fraser Health when challenges were there, or Vancouver Coastal Health. We support one another in difficult times. Just understand how difficult that is. People often in critical care due to COVID-19 then have to fly down to Victoria or to Vancouver or to the Fraser Health Authority, to Surrey or other Royal Columbian or other hospitals. How difficult that is. And yes, we'll take you back, but that is a profoundly difficult thing, to be in critical care. And the vast majority of people in critical care are unvaccinated. And we will support you, yes, but we will not do that in a spirit of blame. But what we have to do, all of us together, is to get vaccinated, and we support all of the efforts of Northern mayors to see that happens.